The facilities are all there and you're not unique. Everyone else is doing the same thing, so don't feel scared of it, is the starting point. The next step is you've got to diagnose before you cut. So you shouldn't start with, I want to cut more. You should be starting with, I need to be better at diagnosing. And once you're better at diagnosing, then you're okay to start planning what treatments can be done. So don't forget, you've got to diagnose first, treat second, because so much of your planned treatments are based around the diagnosis or the differential diagnosis or the things you need to exclude. As you get to the stage of, I want to do more skin cancer work, I want to do more skin cancer surgery, your colleagues in your practice will be able to start referring to you. So I think it's important to talk to your colleagues in the practice and say, this is what I'm thinking of doing. What do you think about that? So if you've got a 6-doctor practice or an 8-doctor practice and you're the doctor who does the skin cancer work and your colleagues are happy with that, that works really, really well for you, for your colleagues and for the patients of the practice. That's really worthwhile. I've also seen the reverse happen, where someone says, I want to do that, and hasn't spoken to his colleagues in the practice about it, and it's actually been, we don't want that. So have that conversation if you're thinking these sort of things. Then it's about equipment. If you've got really poor equipment, it's hard to do good quality work. So you do need to make some investment, or at least the practice needs to make an investment. Again, if you're the only person using the equipment and the other people are paying for it, they're going to be a little bit upset. Why am I spending money on you when I'm the one generating the money? So that's a relevant part of the conversation as well, as to why you're buying equipment and how much it's going to cost, so that the practice is happy with the expenses that are going to be incurred to set things up. Then it's not a matter of everybody learn how to do this at medical school. That's not the case at all. In fact, we had fairly limited training in doing skin cancer surgery at medical school. So you do need some other education, and often it's just the basics. So in my practice, where I do get people referred in, where I do have other doctors saying, can you please help me do this? 96% of my work is the primary ellipse. It's not a matter of you have to jump straight into the really complex, difficult surgery. Start with the basics, because 95+% of the treatments are just doing the basics. Try to perfect your ellipse before we jump into doing complex things. Some things you'll still refer off, but the majority of the work you'll be able to do yourself. There's mileage, so the more you do it, the better you get at it. At the same time, there's habits, and if you start with some bad habits, you'll just reinforce those bad habits. So with the education, it's going to be a matter of you get to experience how others do it as well. You pick up some little tips and tricks and adjust your current habits to start perfecting how you do an ellipse. And if you can start thinking along, how can I do this better? I can do this now, how can I do it better? Then you'll start doing better work for your patients. And then the other doctors in the practice will think, oh, you're pretty good at this. I will refer things to you as well. And the snowball begins. You'll get more and more work to do, you'll get better at doing it, you'll have more and more satisfied patients, life becomes easy from there.